Hello. Good evening for joining us. This is Church of Pentecost UK Radio, COP UK Radio. You you are tuned in to COP UK Radio. My name is Mrs. Tracy Minta, and I've got with me Mrs. Dorothy Karikari. Our topic for today is parenting children with learning difficulties and disabilities. Parenting children with learning difficulties and disabilities. You have many ways of joining us. You can join us by Facebook, YouTube, or the radio. Call somebody to tell somebody that the program has started. The program that brings you closer to the issues that happens daily in your life. And join in and give us your comments as well. We've got a few people already. And thank you for sticking with us. Parenting children with learning difficulties. Auntie?
Yeah, I think parenting is difficult enough. But when the child has got some form of disability, be it learning, physical, maybe it can be, what do you call it? Being blind, for instance, or can't speak, it becomes more difficult because you, the parent, had to learn how you can communicate with that child.
Okay. So can I just ask maybe that we can explain learning difficulties and learning disabilities? Because what I realize is that even in our profession, most people, when they're writing reports, they just mix it. This person will say the child has got learning difficulties. The next minute down the report is saying child has got learning disabilities. So it's just mixed concepts, but they are two totally different things. So I think that maybe we could spend a bit of time trying to explain what the different terms are. So when we look at learning disability, as I said before, it is often confused with dyslexia and mental health problems.
Yeah.
Some people will say, oh, this child has got learning difficulties. But what is learning difficulties? This child has got learning disability. What is learning disability? We know that learning disability, learning difficulties is commonly classed as somebody having learning difficulties in their learning. And then with the disability, it's something that is neurological. Sometimes somebody can be born. It's not necessarily just neurological alone. So a child can be born with various disabilities. Yeah. But then when we are defining, people try to say, they've got learning difficulties or they've got learning disabilities. So it's important for us. And if we don't take care, if we are using the terms, we might even just mistake that as well. No. Because I know that professionals say that a lot.
Yeah, but yes, if we are talking about someone reduced intellectual ability and difficulty with every, if we are talking about that, someone having learning difficulty can be classified under learning disability. But if, depending upon what level, learning, what do you call it? Learning difficulty, people look at learning difficulty as maybe the milder version of, and therefore looking at someone who may have something like dyslexia. Yeah?
So that's person, learning difficulties.
Yeah,
learning
that's what I'm saying, that person is not that they cannot learn at all. It's just that they find it
difficult to process information
and do the things as quickly as other people can do.
That's
right?
Just it.
That
can be supported.
That can be. Well, whether it's a disability or difficulty, all of it can be supported, but it requires different kind of supporting. because the level that the person will need will determine what kind of support that they have. Because if someone is dyslexic, it doesn't mean that they cannot perform well in school, but the only thing is that the school needs to support them to understand that this child may need more support in learning A, B, C, D than the other person who doesn't. And therefore, you find out that these days, most good universities, even if it has not been identified, most universities will test their first year student to find out, and therefore some of them give them computers. If you're writing an exam, they may give you maybe 10 or 20 minutes more extra because you can do the work, only that you are slower pace than other people. And if we are talking about the difficulties, you can also come across a child who has got Tourette syndrome, for instance. That child is highly can perform okay, can learn, but because of the tics and because of their outbursts, it doesn't mean that that person has got problems with learning per se. They may struggle. They may need some support to sort of catch up with other people, but they are able to sort of learn. They are able to learn, and like I mentioned about a child might be, let's say, can't speak, maybe dumb, if that's the word that we use, has speech impediment.
Speech impediment,
Speech impediment. That child may be very good intellectually. The only support they may need is that how to translate that work that they need to be doing, and that is where it becomes more challenging for the parent, because then the parent might need to learn how to sign to that child. And sometimes for us in our communities, we struggle to learn how to sign with our children.
But that's a disability, though. That's a disability. Or would you class that as a learning disability or a learning difficulty?
They don't have a disability for learning. They can learn. They need support to do that because they can't speak. You understand that? They can't speak. But intellectually, there's nothing wrong with them.
So that's a learning disability. That's a learning disability. I'm trying to put them in groups.
So
because
so
if you do the research, it talks about people people using the term interchangeably, and people are confused about the terms. That's what the research says, that people are confused, and some people may be labeled having learning difficulties when actually having learning disability when actually they have a learning difficulty.
So have you gone through the definitions?
We are just starting.
We're just starting.
So we're just talking about how maybe we should define it.
So it's not the problem lies with people just thinking that, oh well, if there's something wrong with that person, then it has to be a learning disability. But learning disability, we will go to that because some children with serious learning disability, when we are saying that, okay, take this pen and to that place, and you think it's a repetitive thing, they will not remember, right? They will not remember that you told them. So you might have to sort of repeat yourself and all the time. Some of them, they can't even remember that, even if you put the labels down for them, depending upon how mild, severe, the levels that they have got, mild, severe, and
medium.
Whatever. But even the mild ones, sometimes even you've taught them that in the morning, this is what they do. The process of you get up, you brush your teeth, and you have breakfast. Let's say those three things. Depending upon the severity, one of them may be able to get up in the morning and do the brushing and breakfast. Two of them one may remember to get up, but will not remember that you told them to brush their teeth, right? So there is severity of it. And you talked about people thinking of it in terms of mental health or mental health issues, and which is completely different because, like we said the other time, that you can have mental health issues and it can come and go. But when someone has got learning disability,
yes.
it is something that is with them for
Forever.
life.
That's
Yeah?
right. Yeah. So that's the differentiation I want to
yeah.
put out there.
Yeah.
That you have the learning difficulties. There are so many people. If you look at the stars, and funny enough, my kids and I were discussing this on our platform, and they highlighted the top stars who had dyslexia.
Dyslexia, yeah.
Yeah. So you have the learning difficulties, and then you have the learning disability, which stays with you forever, for life, and then you have mental health, which is totally different.
Yeah.
Because you want to talk about the
All right.
differences.
I think it's interesting. Of this morning at PRWC, we had a mental health consultant who dealt with a bit of this aspect of learning disabilities, like Asperger's, which you come in. But coming back to the definition or the difficulties, it says specific learning difficulties affects the way information is learned and processed. So that's learning.
That's the learning difficulties.
That's the difficulties.
So it's the processing of information.
Yeah.
And so you talk about they are neurological rather than physiological. Usually run in families and occur independently of intelligence. So sometimes it's not the disability, it's not the extreme where something has happened where you cannot trace it, but maybe it's something medically related or genetically related.
That's
so
the disability I'm talking about.
Yeah, I'm talking about difficulties.
Disabilities.
The disabilities with the one which is extreme. Yeah. So it says they can have significant impact on education and learning. So when Mami was talking about some of the things they are supported in the university, it's this type.
That's the learning difficulties.
Yeah. And an acquisition of literacy skills. So sometimes it's about the person. So it's giving an example here, like the umbrella is termed to use to cover a range of frequently co-occurring difficulties, more commonly that's dyslexia, for instance, or sometimes dyscalculia and some aspect of ADD and ADHD. So attention deficit disorder
and autistic spectrum.
Okay, so let's categorize it then. We're going to talk about learning difficulties first, and then we'll come to learning disability. That's how I wanted to put it. So we're doing the learning difficulties, which brings us to dyslexia. The first one is dyslexia. In my research, I found at least 4, which comes under. You have the dyslexia, you have the dyspraxia, you have the ADHD, and then there's another one. That one was that was the first time I saw that one, but that's interesting. So we'll come to that. Yeah. So maybe we could talk about the dyslexia and how it's all pans out.
Will you be surprised with dyslexia that sometimes when you phone somebody and give a phone number to them and they write it differently, you just said it, you repeat it and they write it and you have to reflect again.
You have to be patient with
them. Or sometimes I've seen a lot of adults or people who are saying, I can't spell, I can't write. Yeah. And you repeat to them and they say, slow down. Yes, sometimes it depends upon the level. And I've seen families who say they are polite. They don't want to tell their wife or their husband they can't understand. He says, oh, you have to come, I have to be here. Because the information you give to my partner or my child or my husband or my wife is that they cannot remember but to tell me.
So it says that if somebody who has that difficulty, it causes difficulties with reading, writing, spelling, and it's usually diagnosed in children when they start school. Dyslexia is a lifelong condition, but unlike a learning disability, it doesn't affect the ability to understand and learn new information.
Unlike learning disability.
Well, unlike
learning. So it's a difficulty.
It's a difficult. It's a difficult. What the point is with the dyslexia, for instance, people don't realize that sometimes, not that like the person will write name. Is. If you're a teacher and you're marking, you come across sometimes that's why sometimes when people say that, oh, I got to university before, they realize I'm saying, what kind of teachers do you have? Because I trained before becoming whatever.
They should realize that
You
right
will
from the
see
beginning.
when the child writes there, they'll leave out the E, TH, S. They'll write the S, they forget the I. There are some things that you can look at and you can say, oh, well, there must be something sort of going on here. Because that child may be maybe they're cleverless in your class. But it's just that when they write things, some of them, their handwriting is atrocious. And so there are some signs that, but it doesn't affect their intellect.
It doesn't
affect their intellect at all.
Yeah.
And I know that years ago, the dyslexia, people used to say that it was the rich person's child's disease because they were very hot on pursuing whether their child was dyslexic and getting support for the child in school.
And I was going to come to that in a minute.
When doing that.
They don't, So it says here as well about signs of dyslexia. So you've touched on about how teachers should notice it. We've got Sandra, Veloni, we've got a few people joining us, and Pastora Mary as well. Thank you.
Hello,
She's always joining us. Thank you very much for joining us. And your contributions are very important as well. We've got Mami Sewa and Brakatu. Oh, my tree is very bad. I don't know how to read tree.
Brakatu. Sewa Brakatu.
Yes, but coming back to this, it talks about the if you look at the symptoms.
That's my in-law.
I see. The symptoms of dyslexia, it says reading and writing very slowly, and poor spellings or handwriting. It says writing letters in the wrong order, as you highlighted, or the wrong way around. Difficulty understanding written information, and difficulty planning and organizing tasks. So here, it doesn't say numbers, but it's more of
numeracy.
Numeracy is down there somewhere.
Sorry, it's normal.
That's why I want to highlight something in the numbers area. That's what I'm specifically saying. It doesn't say numbers. Because if you come down and you look at the dyscalculia, it talks about the numbers.
They are the numbers. They are the number of people who struggle with numbers.
Exactly.
But,
so where you talk about the is white man's thing. When I was doing the research, it talks about the white people and black people and how we look at it. And I remember my son was telling me this week. He would put it on a raffle. He said, "Oh, dyslexia. If you look at dyslexia in African homes, we will say, oh, God forbid. The thought of it." All we say is God forbid. We don't take time for our children to be looked at. If I go to school and the teacher says to an African parent or a Ghanaian parent that, oh, your child may have dyslexia, in the name of Jesus, I cancel it.
But apart from that,
people are not looking into it.
Apart from that, children are beaten because why can't you spell?
Exactly.
Your little sister can spell baby. Why do you spell your baby and spell B-A-B? And say you've written baby. Is that. So that is what makes this dyslexia very, very difficult because the child is clever enough, but their spelling is very bad. The way that they write is very, very bad. They could have very poor reading skills as well. So it is automatically, like you're talking, we are talking about in the African family, where the younger child can say things like a parrot. And then you are the older child who's got dyslexia, who can't. You are seen as not doing very well. But it's a form of difficulty that you have got that you need support, not being shouted at, said that you get over it. It's not something that you can get over it. But you learn to live with it. And when you learn to live with it and you are happy within yourself to say to people, because I know some children who like we are talking about black people who were diagnosed of being dyslexic, they chose themselves not to have the dyslexic label because they don't want that label. They've done very well without it. And I will say to you, well, why don't you want it? Because if I'm writing exams and they can give me 30 more minutes, why won't I take it?
Exactly,
Yeah, because they will give you more time to do your work. Universities give computers to all the dyslexic students. So there is something that, whatever, but we shouldn't shy away from if they're saying you're dyslexic, because it will let people understand why, especially when you write your exams. The examiner is looking at it and thinking, you don't make sense.
Dyslexic,
you don't make sense to them.
But they can get the sense of what you're trying to say.
But if they will have the patience and have the sense of what you're going to say, you hope that that will happen. Because here, for instance, all the dyslexia students will have it printed on their form before it comes to you as a marker. So you know the person is dyslexic. So the ones who's not taking that dyslexia thing, they will not have that on their thing. So the examiner will not be extra cautious about marking that child's paper. So it's
and
really
then I can tell you that in those days, I'm sure that there was so many people stopped attending school, for example, in Ghana, because their learning needs were not identified. When they were not identified, they were beaten at school, they were called names, they were bullied, they were treated in all sorts of manner because their actual learning needs were not identified.
But I mean, and as of now, I think it's not being identified, because the reason why in this country or developed nations they've managed to manage the ones with difficulty very effectively is to have the school nurses in the schools, right? In Ghana, we don't have those
school
things.
Nurses,
and I always say to people that I don't know how children in Ghana and maybe some, I don't know, other African countries or maybe in Latin America, we don't have anything like that. So if you're a child and you are short-sighted or long-sighted or whatever, you can't read anything from the board. And you are seeing that, and that is a difficulty. It's not that you can't do the work, because you can't see, right? And only the glasses will just get you over that obstacle, the difficulty. But because no one is screening you for that,
I know.
you'll be sitting in that class and you'll be
sad,
called wabon, and you will not achieve. And there are children also who may have hearing problems. They are not the ones who don't have got speech and hearing problems. They have got only hearing. So they are in class and the teacher says, "Hey, Dorothy, what did I just say?" And I'm looking at it, blank face. And that means that you were not listening, and you'll be punished. You know, and there is a condition too, epilepsy. Epilepsy people do have petit mal. Okay, and the petit mal happens when you are talking with you for what they get a blank space. So when you have got a child like that, it's a difficulty, because at that time that you're teaching, they will have blank. They will not hear for a little bit. Sometimes within a minute they recover. Sometimes it's not even to a minute, maybe 30 seconds. But that makes it difficult for that child to follow teaching what is going on. And when no one knows about it, and we are talking about, especially when you're in Ghana, no one knows about it, and especially epilepsy, no one even want to mention about epilepsy. So even when they know it, they don't even want to tell the teachers and whatever. So it's one of the difficulties that we have got, because we are so frightened about, we forget
stigmatization and
about
name calling.
And we are so afraid of talking to teachers, talking to people that my child has got epilepsy. Because if that child has got epilepsy, they are going to swear, because sometimes they do have the fits. And the fits, not the ones that they fall down. Like I'm saying, the ones that happen where they have got glazed eyes, they'll be sitting down, but nothing. They don't hear anything until they recover. And that affects teaching. That affects their learning as well. But it's not that they have got difficulty in learning, but it's just because it's as an obstacle is preventing them from learning effectively.
Let's move on to dyspraxia.
Yeah.
From this, we move on to dyspraxia. Dyspraxia is a form of developmental coordination disorder. Yeah, affecting fine and gross motor coordinations in children and adults, often occurring alongside dyslexia.
Often alongside.
Yeah, it's happening alongside them.
It could be not necessarily dyslexia, but it could be on its own, because I know of somebody who has been diagnosed in university too.
And so when the head psych sees the report, that's the report. Sometimes they will say, "Oh, it's called dyslexia and dyspraxia."
The problem is that dyspraxia, for instance, when someone got dyspraxia, you have to assess the person whether they have got dyslexia. It's like when someone is someone is asthmatic, you automatically have to test them for eczema. It's like that. You have to check whether they have got those two, because they are sensitive to something. So it's the same thing as the dyspraxia, but you can't have someone who's got only the dyspraxia.
And it's interesting with dyslexia. This
if you don't take it, you can't pronounce it.
It's interesting
and
that
dyslexia.
that I've come across young persons who are going to adulthood, and this condition or disorder was noted in such a way that people around them very, very clumsy. They hold a plate and they will drop it.
Dyslexia.
No,
dyspraxia.
Coordination. They cannot ride bike. I've seen it. You can't ride bike, and you say the same comparison. Oh, you're 10 years, 5-year-old can do it. You are 10 years, so you have not been doing it. So you remember that there are some challenges as they grow along, and they become adult, and it's those things where once it's identified and it's overlooked. So sometimes they don't even show it, because for them to hold a plate, or you think that they are clumsy, but they are not able to coordinate things. And if you are not able to support them and they are not able to have the courage to do it, as they grow, it becomes a challenge. So those are the things in terms of parents. And I think what Mommy said earlier and what we are saying, all this condition, is that parents need to be aware of what their children. And sometimes we read these things and go and make a diagnosis. Nobody will take it. You read this, and if you go to your GP and present the symptoms, then they will diagnose, or any school nurse or something. So it's important that as we see things at home about our children, the common things we expect them in terms of age appropriate to be able to do, they are not able to do. And if you find them to be in any of these categories, you can write them down. You can notice them, so that when it's come to reporting to the school, to the an expert who is assessing them, then you can add it, because they are not going to be interested in what you are saying rather than the symptoms you see, the examples you see, the difficulties the child or even as an adult you are going through. Because I've seen people who cannot even use simple things to open things, like using. They struggle, and you might say, what
it's true what you're saying. This is what the definition says here. It says, current research suggests that it is due to an immaturity of neuron development in the brain rather than to brain damage. People with dyspraxia have no clinical neurological abnormality to explain their condition. Coming down, it says people with dyspraxia may find tasks requiring balance, such as playing sports, as you just explained, and tasks that require them fine motor skills, such as writing, very difficult. It is a lifelong condition, though it can ease over time. And then finally, it says here, dyspraxia is more common in males.
That's
and is thought to affect up to 3% of the population. Although dyspraxia doesn't affect a child's intelligence, it can make learning more of a challenge for them, and they may need extra support at school.
What I was going to say is that sometimes, parents, when you are within the health service and the health visitor says, bring your child for 8 months check. Some parents opt not to go.
Because the child has been all right.
All right. At that age, that is when we check whether the child is dyspraxia or whatever, because we check their fine motor skills. We check their motor skills, and especially the fine motor skills. So sometimes you go there and we ask your child, we put their blocks down and say, can the child, we put it on, can the child put it on, right? Can the child pick that raisin from the floor? Can the child tread that big thread through that hoop? It's all this, and people think, oh wow, they are wasting my time now, whatever. It's just
they
trying
don't understand
to check their coordination. And sometimes we want to sort of find out it's your child, if the when the child, because when someone is has got this dyspraxia, for instance, the children, even when they walk, they tiptoe.
It's
they
true.
tiptoe.
And
so you are asking the parent, what you saying the child, do they put their foot flat on the floor? And someone is saying, oh, but I haven't seen. But how does a child walk anyway? Tell me, I know how a child walks.
Maybe then the health visitor needs to explain to the parent that, okay, I'm trying to ascertain whether the child has this, that, or that. Because otherwise, the parents just are complacent, and they don't take it seriously. Whatever you're trying to do, it doesn't mean anything to them.
So I would say to you that if you have got a child and you've got, normally, apart from your 6 weeks, if your child 6 week check that we do, if your child is well, you'll go for your immunization. You don't need to even speak to anyone. But the most important thing is your 8 months, your 12 months,
12 months,
and your 2.5 to 3 years
before school.
We need to see them to make sure that everything is okay. And sometimes we think, oh, well, everything is good. Why do I have to go? And but it's really, really important. And especially last year, I came across this child. We are talking about this. And I'm looking at him, and I'm asking the mother. The child is about a year old. And, when, every child would just go and grab pencil. The child doesn't have pencil at all. Because I was watching that child, and the child goes like this. Something like this. When I want the child to use this, thumb and that finger to pick things up. So I'm sitting down there, and I visited a church, looking at the child. And when the church finished, and I'm asking the mother that, oh, when was the last time you went to see your health visitor? I said, oh, but these days you ring them, they are never available. Oh, blah blah blah. So I said to her that, well, how old is your child? She says, the child, oh, he's almost 12 months. And I said, well, then please just take the child in to see someone. And then she said, oh, why? And I said, well, I don't like the way that he grabs things. I don't think he's grabbing it to age appropriate. As I can see him, he takes things, 2 hands is okay. But tiny things, because you see when children, when they are crawling, you see that they try to pick, because they want to exercise their fine motor skills. Any tiny thing, you see that child is picking it up. So parents will say, oh, how come you can find the tiniest thing and put it in your mouth? It's nature's way of that child trying to sort of use that, practice their fine motor skills, So it's really, really important that as parents, like you were saying, we keep, Uncle said, you note things down. As you go along, I haven't seen, oh, the other child did this or this one, but this one hasn't done whatever. When you go and they say that, especially when people say to me that, oh, well, that child had teeth at 6 months, but this one doesn't have teeth. And I'm saying to you, have you asked your mother when you had your teeth? And often you find out that someone, you or the husband or whatever, said, oh, the husband started growing teeth when he was a year old. There you go. There's nothing wrong with that child. That child have whatever. So it's always, as parents, we have to sort of ask the questions to the right people and get the right answers. It doesn't matter. When you ask and there's nothing wrong with your child, there's nothing wrong with your child.
I suppose people have to be more vigilant. Parents have to be vigilant and really aware of what's happening, the children's development. These days, we are in an information age where there's a lot of information out there for everybody. Even if you don't know where to look, you can always ask someone else. As we're talking here, for example, you can always come to us if you have any issues. you talk to us about. If you don't see your child very well, like you're watching your child at home and you can see, even if you come to church, you can see a 2-year-old behaving differently from your child, you must raise questions. Don't just overlook things, because parents do overlook. Some parents do overlook things. So it's very important. If again, it says here, it says you know, a child with dyspraxia has problems with activities that require any kind of physical movement and or
they
coordination, such as playground games. So when they go to the playground, they're playing, and your child is not playing as active as a 2-year-old should be. There's basic sense that we should all have in that sense. You know, if your child is not doing something that a 2-year-old should be doing, you should know. It says navigating around the house including going up and down the stairs. So you will hear that the health visitor is asking you, is your child able to climb the stairs unaided? Or does he need somebody to help? And you think, oh, what a silly question. No, it's not a silly question. You may not know why the person is asking that question, but it's important. Writing and drawing or doing craft activities. Tying shoelace.
Tying shoelace.
Or buttoning up buttoning up clothes.
I often tell parents that if you're really unsure, the best test for this fractured child, you do the circle and you say do it.
Or you ask them to draw the same circle.
Same circle. They can never do it. They can never do it. That's why when they come, 3 years, 18 months, we put it in front of them and say, draw. And then you draw the circle for them. And some of the children, they will draw almost as good as you have drawn. And then you do your triangle and then you say draw. Just to see how they do. So there are some things that we can do at home ourselves. Just drawing circles.
But for our people, Auntie, they are dismissive. They say, in this country, they always want to give big names to our children. They want to give big names to our children, so they won't take it up. If they see anything like that, they won't take the child for assessment. They will say, oh, for me, Bunny, you're okay. My child is okay. Why should I, allow my child to be labeled or something? But actually, if that need is identified, the child is protected provided with appropriate support. To improve or enhance the child's learning, or to support the child's learning. So it is important that this is whatever need is a learning need. That if it's identified, appropriate support. Maybe the child may need a TA. A TA, a teaching assistant in class. So it's important to identify those things so that your child can achieve its full potential. Because if not, then he will be lacking behind.
Lacking behind, and at the end, the child will not be able to, because if you know your child can't catch a ball, for instance, the dyspraxia child, if you throw a ball to them, because they don't have that right coordination, they won't be able to catch it. They catch that ball. And you're trying. I mean, I know someone, all that they used to do is beat the child. So please, if the child is like that, don't beat the child.
Oh my God.
You are getting jobs for social services.
You are
they will tell you abusing your child.
So if you beat your child because they can't push throw a ball or write something.
Or catch a ball. How come
that is serious.
A boy who can't even play football when he can't catch it?
That's abuse. That's even emotional abuse to the child.
Well, in
my thinking terms.
But you have to see abuse in everything. I mean, for me, because it's abusive. Because that child can't do it. They need support. And also, what we forget as parents is that as you stress on it, you are making it worse, and the child is getting agitated and getting anxious, so they won't be able
to becoming timid.
They won't be able to do that, And then when they go to school, you are saying that how come you go to class and your teacher says you never say any word? You've intimidated that child from home. They go out there. They are afraid, like you're saying. You are afraid. So, it is a challenge, but it shouldn't be such a challenge that we make it worse for the child.
The parents make it worse. Or even the sibling. Because you, the parent, if you make it worse, their siblings, the older siblings or younger siblings will copy. And then they will tell him everybody becomes a stupid person within the family. He becomes the person who doesn't know anything in the family, and then he's told constantly that he's stupid. Therefore, that's what he internalizes, and then goes out there and he doesn't do well. He or she doesn't do well.
So I think it's when you identify these things as we are talking about, then you do a bit of research, ask questions, and create the environment. Because once you start with labeling, once you start with the negativity, no, or you can say in the nice way that, oh, you seem to struggle not to be able to open this or that, and do you need help? So once you know it, sometimes once you support the child, it becomes more easier than, and they will come out because they will want to learn. Oh, I try always and that's why I'm not able to do it. I'm not good at this. Okay, let's try it again. So other than that, you put in a labeling, especially when you have a larger sibling and become competitive.
And they will laugh at
and also, especially there are gadgets there that will help the child to lace up their shoes. Or if you know the child is struggling with lace up shoes, buy them shoes that they don't have to lace up. Right,
but then do they not need to learn how to lace up shoes?
Gradually, you teach them, but as when they are struggling, you think that because some of them will get really distracted in the morning, get really fearful that they might have to tie their shoelace, said that they get worked up. If it's possible, just buy them a shoe that has got the lacing, that doesn't need lacing, and then gradually you can teach them how to manage the lace, because obviously when they grow up they don't want to wear the Velcro shoes all the time. They may need to sort of
just pull it on.
But you need to sort of spend time and give them time, because if you are rushing, all that you do, you'll be shouting and you will not have patience on that child. But when you are at home, you can practice with the child. Gradually they'll get it, but it takes some time.
So let's look at the next one. We welcome Mark Egan as well, Patience Watson, Evelyn, Japan, Sandra. We've got Pastora, Veloni. Pass your comments and let's just debate on it and discuss the whole thing. What are your experiences? What have you seen or observed from other children? How have you seen parents,
siblings
parenting other children with learning difficulties or disabilities? The next one is, are you ready? Dyscalculia. Dyscalculia. And that is developmental dyscalculia is sometimes described as mathematics dyslexia.
Difficulty in understanding math concepts and symbols.
It's me then. I think it's me.
You are not that extreme.
A lot of people have.
It's me. It's a specific learning difficulty which makes learning basic as arithmetic, facts, processing numbers, and carrying out calculations difficult. Listen, I've grown up saying to myself, I don't know maths. For that, I can do maths, all right, basic one, so maybe it's not me. But no. I can do maths, but I don't like maths. For that reason, I block myself.
One thing about maths is that I got to know it when I was at uni, that you got to have somebody who shows interest, because I did developmental planning in my first degree, and I remember very well that we in our course we have people who have come from us proper and come to developmental, people who have done maths and all that. So they were far back. So those of us who have come from geography, economics, and we were struggling, and it was basics. But when we were doing this statistics and maths, some of the things we were taught or we were encouraged was that we have to do sometimes referral and going. But always when we did the referral and went back, some of us were able to get A. Why? Because now you study again and you realize that it's the fear. Or the things,
the fear, and
this phobia. So coming back to this idea of basic calculation,
it's
important that basic. It's basic that the concept, you make it interesting, you make it, and most times, unfortunately, children don't get people who have the skills or back home, especially to be able to. And here it's different. Sometimes they encourage you, but it's about you also, parents. If you notice that your child is struggling, it's basic, because maths and English are the basics. So if you're able to support them,
child assess, because if they are,
or even if you're able to get extra support, and sometimes it's just a fine line, because it's not everybody who's going to be a big mathematician, but at least it's the basic to be able to kind of have the confidence to add to read and understand the concepts. So those
Well,
are the things we
yeah,
have to be aware.
We have to be aware
experienced to,
about. I mean, as joking aside, we all go to the shop and buy and know the change.
Yeah.
Okay,
So you are good at
you are
maths.
good at maths. Yeah. Oh
Yeah?
no, don't mess
You're
with
talking
me.
about the
Don't
basic.
mess with me about
Yeah,
money.
money,
I
yeah.
can
So-
calculate everything.
Yeah, exactly.
For you.
So you know maths.
Yeah.
It's just that the concept of sometimes when you don't get a good teacher, you become afraid of maths, right? But everyone has to know the basic maths. And that is where the difficulty is, because I know this young lady who was excellent at everything, but this girl, don't send her with £5 to go and buy something like £1.80. If they give her the wrong change, she wouldn't.
So she's got this calculia.
Yeah, she wouldn't know, right? She wouldn't know. And sometimes, I never thought about it that so when her mom wants to send her to buy something, either she gives her the £1 coin, everything that she will go. So
Yeah, exactly.
she can only send her, when Iceland used to everything £1, she can only send her to places like Iceland where the girl gets a thing and it says £1, and then she will give you the £1. But if it has got change, she struggles with it so much that I had to say to the mother that it's gradual. Instead of you shouting at her and saying, "Oh, you let young people," so school people got to know about it. So when she is going to buy something, they say, "Oh, give me your £5." And when they come back and they say, "Oh, here you are, £2," even if she bought something for maybe £1.50, she couldn't work it out. So people were so it's about, if someone is like that, like Uncle said, they need proper support from school, and school needs to know that, because this is something that they have to have. This the
You have to
English
have,
and
once
maths
they
you
know,
have
they
to
need
have.
to have that
We have
support
to have
for
that.
her.
So
Yeah.
it's about supporting them. But as parents, you can do that with money, because everyone likes money, isn't it? You change the 10p's and the 1p and whatever. And I find that it's easier teaching someone, you the parent, you may think, "Oh, I don't know maths," but change. So you get 10 1p's, 10 2p's, 10 20p's, and whatever. And that can be used as helping that child to understand whatever. So you give them like, because some of the games that has got money, paper, the £10 and whatever games, forgotten the name.
Monopoly
It's the money,
and all of
yeah,
that.
the
They
money
have
games,
money,
for
yeah,
instance. It helps because it's using play as a teaching
Tool,
tool.
It's a teaching tool with
So
the
it's
children.
really, it's really important to use play, rather, especially the child that can calculate things, because people can take advantage of them if they are going to buy things. So just use it as play and encourage that child to sort of take part in it. And when they get it wrong, we shouldn't be laughing at them that, "Oh, well, you didn't get this simple one out," because then it stresses the person out and the person doesn't want to sort of carry on. But it is, the calculus thing, it is really.
So it says here the signs of dyscalculia includes a poor sense of number and estimation, which you said about, weak mental arithmetic skills.
Yeah.
So they can't do mental. I remember when we used to go to school, our teachers used to beat us like mad. They come in the morning with cane, and they will say all the mental 2 times 2 this, that, and you just get whipped all day. Your body will be burning you because you haven't been able to do your mental arithmetic. We have difficulty in remembering mathematical facts and procedures, even with extensive practice.
Yeah.
It's interesting here. I also did a research. You talk about telling the time.
Yeah.
Timekeeping.
Timekeeping, yeah.
It
Understanding
said that's the
quantity,
next. They say, okay, taking
prices, and money.
Money, yeah.
Difficulties with numeracy and maths are common.
Yeah.
Are also common with dyslexia, as we said earlier. So sometimes there seems to be interchange, or there seems to be the similar.
So it's taking a very long time over calculations. Difficulties counting backwards. Inability to tell what answers are right and or nearly right. So exactly what you're saying. The next one is dysgraphia. Dysgraphia or dysgraphia. So it says this one is a common condition that affects the ability to recognize and decipher written words and the relationship between letter forms and the sounds they make, isn't it going a bit too far in terms of this graphia and this whatever and all of that? What's not? Is it not going too far?
Well, there are
when
some,
I saw it, I'm thinking.
No. It's with children. There are some children. There are some children who can't tell between 2 and S. Yeah. Yeah. So we are talking about someone who visually can't tell the difference. There are some letters.
The 3 and the E. 3 and E.
They can't tell the difference. That's what they're talking about. They can't tell the difference. So
you think there are adults who can't tell the difference between 3 and E?
Yeah. Okay. If you have got that, you grow with it. So instead of you writing E, the person may write 3 because E looks like this. And 3 looks like that. So they
won't. Any adults that write like that.
Yeah, they will interchange it. Yeah, they will interchange it. Yeah, they will interchange it. So, yeah.
So it says people with dysgraphia will likely struggle to write neatly. And their letters, numbers, and words, punctuations, and words will often appear jumbled. Dysgraphia itself does not affect intelligence.
No.
But can often present in people with learning disabilities. It will happen in people with the learning disabilities. Okay, we get that. So it's unclear, irregular, or inconsistent handwriting, writing very slowly, mixing styles and upper, lower case letters. So we understand that those with learning disabilities. So it means that they have intellectual issues.
Well,
the people with learning disabilities, they'll present with this kind of.
You remember that we're talking about dyslexia, that it's running through all the other whatever. It's about people not having good memory of what they've been taught. So they all run through the same.
So the last one, we look at, because we could look for different learning difficulties, but the last one, and I think the very one, this is a popular one, that's why I left it for last, which in our job we hear every time. He's got ADHD. He's got ADHD. The children are attention deficit hyperactive disorder.
And also this stroke, ADD. And that's attention
deficit disorder.
ADD is
ADHD is attention deficit hyperactive disorder or hyperactivity
and also the
disorder.
ADD is attention deficit disorder.
Attention deficit disorder. So how?
Because the ones who have the deficit disorder, some of them can be very, very sluggish. Very, very sluggish. Whereas this one is hyper
all over the place.
The deficit one, defiant. It could be. It will sit down. You tell them to do, and I'm not doing it.
Which one? The deficit one.
The deficit one will sit down, not doing it. Hyperactive will be here, sit down 2 minutes. Once the 2 minutes over, then it's also there. So it's about sometimes how you.
So let's define the attention deficit hyperactivity disorder. So that one, so in short, is called ADHD. Is the name given to the group of behaviors which include hyperactivity, as we just said, and inattentiveness. This child is not attentive at all. They're just running around, jumping all over.
And impulsive.
And the causes aren't known, though the condition seems to run in families. People with ADHD are normally diagnosed as children between the ages of 6 and 12. Around 2-7% of school-age children are thought to have the condition. Many people outgrow the condition during adolescence. However, around a third to a half of people with ADHD continue to experience the symptoms in adulthood.
Excellent. Just to add to what I said earlier, today we had this consultant psychiatrist who said that just this week he has done some
an assessment
on somebody who 2-3 weeks came to his office because he was transitioning. I think a young person who is moving from children to adulthood. And he said when he came the first time, he will not sit down. He was all over the place, and he used the term that ADHD, which is not diagnosed before the adult, once you are able to, it's treatable. Because he says when he came and they were able to give some medication and some support and some strategies, this second follow-up assessment, which he did this week, the young person sat there, they were able to communicate, he could see the difference. So all that he's saying is that, going back to what we've been repeating, when you see these symptoms, don't just sit down there, because the child, it happens in school, it's happening at home, it's happening in the community church. Go and seek help so that it doesn't get something which always be a challenge.
You're really spot on. It says here, people with ADHD benefit from early identification. Exactly what you've just said, of the condition by healthcare professionals. As appropriate support and behavioral therapists can put in place to avoid underperformance at school and the problems that can lead on from this. So in terms of avoidance from underperformance, the class teacher said, the class teacher will say, this child is got this, is not behaving well, is they label the child with all sorts of things.
And it's observation. So sometimes you got to be honest to say they've observed something, because sometimes you hear parents say you are this. What you observe,
racist,
you got to match it with what they're also observing. So it's not like it's how people handle it that sometimes become a problem. Because if you don't know this thing and you drag the child and you put the child on the seat, it will last for 1 minute. Next second minute is off.
Auntie wanted to say something.
No, what I was saying that as parents, a child with HDHD, impulsiveness is one of the things that parents see first, because that child will not sit down, but they are impulsive. If they have to climb this window, they have to do it now. And you have seen that at home. So when you go to school and they say the child doesn't sit down, doesn't play, whatever, why are you arguing? You need to sort of find that. Then the question is, you've seen all that here. Has the child been referred on to be seen by some specialist? Because it's really important that the child gets moved on and gets addressed. The only thing I would say is that HDHD, the only thing is, yes, we put them on medication and it helps them.
But it's not good because we've had a lot of. I remember you go to a certain homes and then they will say, "Oh, I'm on medication." Young people, they put them on medication. We hear and I've heard. Correct me if I'm wrong. That the medications are not good. They are pumping medication on these young children. Can you imagine taking medication because of behavior? And I can tell you, yesterday, I went to see one of my children. These young people I work with, of course, not my own child, but I always say my children. I went to see one of these my children, and he doesn't sit still. He's running around, throwing things. They will just throw the pen. Doesn't think who is going to hit, jump on somebody. So you can't have a conversation because you can see him all over the place. I think that first of all, the carer plays a key part. Number two, the environment that you place the child is also very important, because once I move that child from one carer to another, the new carer was reporting to me and said to him, "You can sit down now and listen to stories. I remember when you came just a week ago, you couldn't sit down for 10 minutes. The whole family will sit down and read. And the adults, the carers, the couple will read to the children. You have 5 children. So they will read to the children. But when they read to the children, they were reading to the children. When he joined the family, he couldn't sit for even 10 minutes to listen to the story. He was just all over the place running around. However, as of yesterday or as of Friday that I visited, he's changed. And he was able to sit for 40 minutes. Apparently, he sat for 40 minutes. So I think that the environment is also important. And the carer the carer skills is also important.
Well, yes, it's true. But the point is, there are some children, when they are diagnosed of HDHD, needs to go on medication for a while. I am not pro 3 years they are still on this medication, because apart from anything, it makes them lose so much weight. some of these children, they lose so much weight. The medication is not meant to be taken continuous.
Yeah.
But sometimes whether the carers don't know or they are not told, or I don't know, you find out that child has been taking the medication
for
a
long
time without having a break. But the medication is supposed to be taken for 6 months, and the child is supposed to have about 3 months leave in between. Review so that they will be reviewed while off medication and see how they react. And sometimes I think that sometimes too, like you're saying, the environment on also, if you have got a child who has got any form of challenges that they have, you need to set boundaries for them. They need to know what you expect from them.
Exactly, yeah.
Right? When if they don't know what you are expecting from them, because you know this one has got attention deficit disorder. So tell them, yes, it's okay. And I always say to some of these carers that, listen, 10 minutes first time, then you increase it. You won't tell them, increase it by another 5 minutes another time. You keep increasing it. By the time that child realizes, they are sitting down for 1 hour without getting up. Yeah? That you can't start off by saying, 1 hour you're sitting down. That won't work.
But that's too long.
Right. Yeah, that is too long.
And exactly what Marty said. This young person you're talking about, the
yeah.
strategy, for instance, the career probably. Some of the children, you may have to give them, even if they don't want to go to the loo. 2 minutes to go and loo and come back. So it's a way of managing it. And gradually you realize that they just fit into it. Because the environment is equally important.
It's very, very
because
important.
If it's ADHD and ADD, and they are all over the place.
There's no boundaries. There are no boundaries and expectations. And you have to be very assertive with them.
Yeah, and because you are helping them.
Because what is important about these carers, the example you gave is that you are also there to support them. You're also there to observe. But if you are watching your football and you want the child to be there, they are also going to do something. So sometimes you got to set a time, even if it's half an hour, before your football or something, to be able to.
It's not just the football. This
the mobile phone.
This mobile phone.
Or somebody on 1 hour and you want the child at the same time.
So the child is left to their own devices. That's how it started. People are not born with it.
And I always say to people that, listen, if you want a child to draw your attention negatively, they will do. Because a child does need attention. You can't be sitting with your child. These days, this mobile phone, sometimes haven't you observed that? A mother and a baby in a pushchair, the mother is busy doing something with their mobile
pushchair, and then she's doing the mobile
thing. And then the child
crossing
is
the road.
Crossing the road.
And at the same time pushing one hand and answering. And I say, I usually, if I'm so considerate, I said, it because the child, I'm not going to blow the horn. Because it's just that the person is not concentrating the environment. And what kind of call that you have to tell the person I'm crossing, we talk later.
I mean, I tell you, because I remember a woman.
The child is crying for the attention.
Exactly.
And yet the mother is whatever. And I'm thinking, I said, what? And I said, it better be £1 million. The other time, I made her laugh. Because some of them, they look at you like you're crawling out from under a stone somewhere. But this girl, she laughed because the child was crying, Mom, you know the ones that can have whatever. And the mom is and she's on her phone. I said, well, it better be in 10 million that they are passing through this phone to you. And she turned and I said, well, because this lovely child is crying for your attention. I can see you on this phone from that area. So I think it's 10 million. You better give me part of the million. And then she smiled. She said, oh, that's not the case. Oh, my friend said, well, but please.
Your friend is more
important
than your...
is calling for your attention. I said, you are out here. You don't know. I said, the other time, I went out with my goddaughter's child. And when we turned our back, whatever, he's just vomited. And because he was young, he couldn't say, can you imagine?
You can choke on
the vomit and whatever. So when your child is wanting your attention, like you're saying, because no attention. Sometimes no attention, no attention. It gets to a point that the child started acting
up. And in this instance, I could see the clear change because this couple are very structured. They've got their own 4 boys, and I've gone and added another child, and so they're really structured from morning to evening. You're bringing up boys. You have to structure your life. So they're really structured, and they talk to the children, and so you could see the change already in the boy by behaviors. He's running, and adults have come to talk. We're sitting there talking, and he's just there good. And I'm saying to him, no, you need to sit down. We have to say to him, no, you need to, sit, excuse us. We have to talk and all of that. But the point is that he was not initially. He was really a change boy. But it's been only 5th of May that I put him there.
You see?
So can you imagine within 20 days or under 20 days, he's changed already. I just read the signs and then we'll take a break. So the signs of ADHD, so that when we come back, we just go to the learning disabilities. It says that as inattentiveness, which you said already, short attention span, which is in the example I just given. They're easily distracted. So you have a child who goes to school and constantly they're saying to you, this child is easily distracted. He doesn't learn. He's distracted, but you need to look into that. And the child is seemingly forgetful. They've got inability to persevere with tasks. So you need to look into all of that. That's the inattentiveness bit. And then you have the hyperactivity bit and impulsiveness, which Auntie has said already, and constant fidgeting. And they have inability to concentrate, talking too much or interrupting others in class or wherever they are.
And poor social skills.
They have poor social skills and inability to wait for their turn. These are all classic signs.
Poor listening skills too is mentioned. Lose track of what they are doing.
Acting without thinking.
Time management. They don't think about time at all.
No.
Little or
half
no...
an hour and they do 1 hour and you say, no, I haven't finished.
And they have little or no sense of danger. So they're climbing up and down, moving things, no sense of danger whatsoever.
So you got to do a risk assessment.
Exactly.
What do you put around there? Depending on the age,
And we, the parents, we do have, these are really classical signs, common signs that you see. Tell me, you parents, I'm sure you've seen in your children's reports, this child is this short. If they've got, I think if they've got one symptom or one sign, that doesn't mean they've got ADHD or something. No. But you know, if a combination of all the signs, then you need to be requesting.
And also, one of the things parents need to be aware, or carers, grandparents, and everything, is that when the children come to you and they put up some behavior, because just to add this week I've heard about somebody I'm working with, and the classic example is when he goes there, a 12-year-old. He behaves herself, but when he's here, it's the environment we are talking about.
Yeah, it's the
because whenever you go to where this mother is complaining, it's always this video game. But when the young person has gone to some other friends who we are trying to do a family group conference support, you could see that she sits down there, she have communication. It's different. So the environment we create as parents or carers or grandparents when the children come to us is equally important.
It's the environment.
It
really
helps the child
important.
you could see the difference in these two home environment. So they might have this ADHD or some of these learning difficulties, but also how we support them or how we able to say, look,
or even
this half an hour is me and you. This half an hour is me and you. You might not be able to, it's not the length, but it's about the quality time. Then that other time, yes, you could observe that they don't put themselves in any danger.
So do you think parents create this kind of behavior?
You got to support, you got to be aware, because sometimes lack of awareness or we just blame the child, but the child's in the home. And if a child, you don't say the boundaries you're talking about. The child comes, you know the child's got homework. You're not going to make them do it in the night, but they are on the phone or doing other things or games. Then the following morning, then the problem starts because you are not managing it well.
Because you leave the child to his own devices.
And also, I think that some of these games that these children are now we buy for them are not helping them at all. You're talking about that environment because, and some of them, because of the actions and whatever, they are watching it, they'll get up and be throwing their, it's okay to have a game for a child, but they don't have to spend all the time they have got on games. Because that, if something, if they go to school and that thing is not like the game, that action all the time, that means that they are not going to listen, right? There's got to be mix. Yes, there are times that you do your actions, there are times that you have to sit and read your book, and there's times that you have to sit and then the family we talk together and we communicate. So it's about teaching the child different skills. That said that when they go out there, they will not stand out like a sore thumb, because as they get really agitated, then the hyperactive,
when they get bored, then the
it
behavior
starts again.
yeah.
They start misbehaving. So yeah.
So let's take a short break then. When we come back, we move on to the learning disabilities, because we've tackled the learning disabilities. I think we've tackled that really at length. And then we go into the learning and difficulty. Stick with us. Thank you very much, all of you who are still sticking with us. And then we'll be back in a few minutes to continue with learning disabilities. We've been talking about learning difficulties, and we'll move on to learning disabilities. Tell your friends to join in. Tell them the discussions are very interesting. If it doesn't, it's not related to you, by all means, you will know somebody who knows somebody who's experiencing difficulties. And then we will, if you need any support, come to us. Thank you. We'll be back right back.
Sometimes I think we forget the principle.
Welcome back. We're back on air. You're tuned into COP UK Radio. This is the Community Welfare Matters segment. You are live on Facebook, and tell somebody that we're discussing the topic parenting and children with learning difficulties and disabilities. In the first half, we've discussed the difference between learning difficulties and learning disabilities, and we've touched a lot on the learning difficulties aspect. So we're about to talk about the learning disability. Learning disability. Remind me not to say learning difficulties, because I really want to stick to that, given that we pointed it out that people use it interchangeably, and sometimes people are labeled wrongly. You write a report and you see that somebody said a child has got learning difficulties. Down the line, they said the child has got learning disabilities. Disability is different from the learning difficulties. We need to get that right. So, Uncle Sam.
Yes.
Learning difficulties.
Learning disabilities
learning disabilities.
Is a reduced intellectual ability and difficulty with everyday activities. For example, household tasks, socializing, or managing money, which affects someone for their whole life. Yeah. So if you are talking about affecting their whole life, and it's how you manage. Yeah. It says, learning disability is often confused with dyslexia and mental problems.
As we said initially.
Describe MENCAP, for instance, they describe dyslexia.
MENCAP is who? Is it?
Mental
health. It's an
Agency.
agency.
It's a mental health agency.
Charity who supports people with learning disability. And they said, specifically because he's one of those, they advocate for people with learning disability. And it says they describe dyslexia as a learning difficulty, which we have talked about, because unlike learning disability, it does not affect intellect. So we are talking about intellect. So the disability is more of intellect.
And the difficulty is not intellect.
So the disability is affecting.
Disability and difficulties.
And also, just to finish up, it says mental health problems can affect anyone at any time and may be overcome with treatment, which is not true of learning disability. So with learning disability, you learn through the whole life thing. With mental health, as you said, or disability, some of them, it's dependent upon the circumstance. So with the
disability,
you got to make sure that along the line, you take the person as a holistic and support them through the sequence. So it could be something small around the corner. Unless you take the person there, the person is going to get accident, the person is going to be cheated. Because that's why you got a lot of carers, or you assess the situation that the person of learning disability is going to maneuver the route and all that. Yeah, which we come to.
So if you talk about learning disabilities, then I'm a victim of my own criticism. So if we talk about learning disabilities, is damage to the brain. Yeah. The damage to the brain before, during, or shortly after birth.
Yeah.
This is when it happens. Damage to the brain before, during, or shortly after birth. Inherited genetic learning disability. So it could be inherited. It could be genetic mutations or chromosomal abnormalities taking place at or around the point of conception. Genetic mutations or chromosomal abnormalities taking place at or around the point of conception. Then it's also illness either in the mother during pregnancy or in the child during early years. So fetal alcohol syndrome will be learning disability. Yeah.
If it's not treated along the line, because for instance, sometimes that's why when children are born and they have that syndrome, the first thing they do with all, as Ma'am was saying initially, from antenatal, postnatal, and all the checks is thorough. Because first you want to make sure that I've dealt with a case recently in court where I was covering with someone, and you could see the symptoms there, because from day one we knew what we were expecting. And this child, when the child was born, they have to even give a higher dose to be able to kind of tame it down, and later the child has now moved to a placement somewhere. But what is important for this was that we anticipated it, so it was planned, proper planning of everything, and it to be followed through. So coming back to these things, sometimes, yes, the mother knew what she was doing, but that was drug related actually. It wasn't, it wasn't alcohol. But it's important that to be able to track it down. Once you know it, and you can plan along. No?
So it's the lifestyle that the pregnant woman led that caused, because it says here about something happening during pregnancy.
If you are doing drugs, especially crack cocaine, does have serious effect on the growing child, and it affects their brain formation and with alcohol as well. That's why when someone is an alcoholic or a drug user, when they have the baby needs to stay in hospital for a long time, and the child needs to be weaned off the alcohol. And like Uncle says, sometimes to start the weaning off, we start giving them a little bit of alcohol to try and wean them off, because if you wean yourself off alcohol or drugs, you just stop it like that, you might kill that person. So it's a gradual process that the baby will have to go
What kind of alcohol do you give to a child? Would you give like medicine or?
Yeah, it's a medicine. Medicine.
In the form of medicine or vodka.
That would be fun. I think the nurses will drink the vodka, and the child won't have anything. But there is soft, mixture that giving them gradually, and then you wean them off. And because depending upon what state that the mother was using the drug most of the time, if it's coming to the end.
So would you do that for crack cocaine as well?
Yeah.
If the child, the child is withdrawing from crack cocaine, or heroin or something.
Heroin, crack cocaine, whatever. There is what's the name of the medicine?
Sabutol and all those things. The medication that you give to the parent.
Yeah, that is given to the child gradually, and then you try to wean them off. What parents don't realize is that it takes you if you're weaning someone off something like cocaine. You can gradually wean them off within 24, 48 hours. They will be over it. If it's heroin, a little bit longer. But the medical bits that we give to them, I've forgotten the name. I don't know why the name is not coming. One, if you're weaning someone, it takes longer. So that's what we are going to give to your baby. So if it was a straight actual drug, that would take less than a week. That baby is going to take that baby, not less than 2 to a month to win the baby, depending upon how serious the withdrawal is. And after that, you have to check whether the drugs has affected the child intellectually. And that is where the difficulty is, because some children will have brain damage due to the exposure to high doses of crack cocaine, on the heroin or the alcohol. And even those, some of them who may not even have the intellectual one, they may have coordination problems. They'll have other issues. Some of them grow up to have attention deficit syndrome. Some of them become dyslexic. So it comes with so many problems, combination of problems. So that is why they've put in the disability becomes very, very high with this group of children, because the possibility of facing challenges that they cannot get over for the rest of their life. They will need support in doing certain things in
so
their
it's
life.
important then that when you're pregnant, you should be very, very careful. Well, it goes without saying that anybody who's pregnant needs to be very, very careful. Sometimes even the food that we eat, if you eat raw meat or raw something, food that's not cooked properly,
that's not good,
it could have impact on your baby. Somehow it's got some kind of bacteria that can affect your baby. So it's very, very important.
And I mean, with the raw things, it can even let you abort the baby or have the baby. What people don't understand is that if you do that, you have your baby early, they may survive, but the disability they will live with will be very, very huge.
Just by eating raw food, something that's uncooked.
Because if a child is born at 27 weeks, and a child that's born in 30 weeks, they're 27 weeks and sometimes even 25 weeks. And that means that that child will have to be in incubator, and we have to graduate how much oxygen they will be having if they were inside the mother. And that is where the problem lies. So most of these children end up being blind, being deaf, to start with, and then they will end up having maybe mentally there's something wrong with that child, or they will have some neurological damage, and then coupled with some of them will have motor skills problems. So it's really, really important that when we are pregnant, we are very, very careful. And some people, they wait, they know they are pregnant, and they say they are busy, and they turn up for antenatal when they are about 6 months, which shouldn't happen, especially in this country. You're not paying for it. It's not as if you have to pay for it. So you have to go and get yourself checked up. And sometimes when we are talking about disability with fetus, common, folic acid. People don't have enough folic acid in their body, and they end up having children with spina bifida, for instance, which is not intellectual, but it's physical disability. That some children, some people will have an intellectual bit plus it, but even if it's physical, and it's something that you could have prevented, then why not prevent it? Why have a child that has got
a disability. Which is a preventable
if
disability.
It's a preventable disability, then we should do our best to try and prevent the child coming into the world with that disability.
Because you have people, and with the job that we do, you are exposed to seeing all sorts of mothers. Some mothers don't care. They will just get pregnant. They will not seek medical help. They will, obviously they're ill because they don't seek medical help, and they will just continue. If you have an old lifestyle, they will continue with that lifestyle, engaging in all sorts of activities that they shouldn't engage in, and regardless of, irrespective of what will happen to the baby. And then you end up having a baby. I know somebody who had twins, and these twins had to be on oxygen. It's not only one, now two. Two had to be on oxygen, and we had to take the babies from her. And she didn't even want the babies. It's so sad because somebody is so desperate for a baby, and you have somebody having these babies, and now you've just damaged, which the disability could have been avoided.
Yeah.
That is the saddest part of it. It could have been avoided if only. So when you go down, it says also, it said, because some learning difficulties form part of the diagnosis of a particular condition or syndrome, they can often be diagnosed at birth.
Yeah.
As we said. So learning, it's not like learning difficulties where you have to do it, you can do it when they are older.
Yeah.
This is at birth.
And
for example, people with Down syndrome will have an accompanying learning disability.
Yeah.
That's when they do the amnio.
Yeah. Yeah,
to
they
tell
do
you
that
that,
amniocentesis. Yeah.
But why is it that sometimes they tell you that after the amnio, I know a lot of people shy away from doing amnio because they are told that they're going to have children with disabilities, but then it doesn't happen. So what's the trust in that amnio?
Well, the point is that the amnio is about averages. Yeah, no one can pinpoint, especially if you are an older mother having a child, and they draw up this fluid and they test it, and the test doesn't come like clear. And these days, with everyone seeing everyone left, right, and center, and you are the doctor, you want to not to be sued or someone saying whatever. So you're going to say to them that there's a possibility. No one tells them that you are definitely
it's not 50-50.
Whatever. They are saying
probabilities and possibilities.
They probably might have a child with Down syndrome. They will never say to you definitely,
because they look at the age. I think people, people got tired of hearing that, because sometimes you think that they look at the age, especially with the older ladies.
That's what I'm saying. Older
women. They tell you that you might have that, and so many people were being told that they will have that, yet they've gone on to have healthy babies.
Yeah, but you should praise God if that's happened and not worry about it. For me, I always say to people that, listen, I have had people who've had Down syndrome on my caseload before, and all of them had been young ladies who were under the age of 22.
Yeah.
And in my case, when I say that, people sort of marvel about that, because I've had 6 in my career life that I used to look after who've had Down syndrome babies. All the 6 women, they were under the age of 21. Wow. Yeah, and that is the age group too. We don't screen. We don't screen. The first one was 18 years of age, and she had a Down syndrome baby. And I remember very well this girl in Croydon telling me, it's so unfair, isn't it? They said that there's no chance of a young person. How come? God is so mean to me.
She probably would have aborted the baby.
Yeah, that's what she said. God is so mean to me and giving me this child and blah, 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 blah. And she was 18.
But some Down syndrome children are really, really okay. Yeah.
Well,
they have their difficulties. They have their disabilities. But
disabilities,
still.
But the second one, who had her, she was just over 21. Just over 21. She had her daughter, and her daughter, now the girl is about 23, and the girl went to mainstream schools all her life. She is Down syndrome. She is doing, the problem with Down syndrome is that it is not an inherited thing. It happens. It is a chance thing that happens. Yeah? So it's not that, there's Down syndrome in your family that's why you're going to have Down syndrome. No, it's a
But in Africa or in our culture, that's what happens.
I think
this guy's family, they have healthy.
It's interesting that here they gave some, say, learning disabilities can cause by any one of the varieties or combination, and he's listed certain things. So talking about this, where we come from, and sometimes it's about the area, what has happened. He says sometimes specific cause is not known. Possible cause includes, so learning disability in general. Which some of them will be. So the categories, he says, an inherited condition, meaning that certain genes pass from one parent affected the development of the brain, for example, Fragile X.
Yeah, that's what I was going to say. You are talking about Fragile X. That is a genetic thing. That is the one that causes autism and things like that. That can.
So it's a disability.
It's a disability.
But going to the Down syndrome,
But Down syndrome,
he says
is
chromosomes
a chance.
abnormalities, such as Down syndrome or Turner syndrome.
Yeah.
So we are talking about a vast variety.
Yeah.
So you cannot necessarily say me mama na hear me or me papa na hear me or something.
Yeah.
Sometimes it's about some of the things we might not know.
No.
Yeah. And it talks also about complications during birth resulting in lack of oxygen.
That is cerebral palsy.
Lack of oxygen to the brain.
Yeah. Cerebral palsy.
A very premature birth.
Yeah. Very premature birth. Yeah,
mother's illness during pregnancy.
Yeah.
A mother drinking during pregnancy for fetal alcohol syndrome, which we talked about.
Yeah.
A debilitating illness or injury in early childhood affecting the brain development. For example, road accident or child abuse.
Or child abuse.
Child abuse.
Yeah, child abuse. Yeah. That causes, what's the name of...
so it says contact with damaging material like radiation. So that's why sometimes you live in a place, or some people were working in places, the radiation, somebody who is, even when you are pregnant and you are working in an X-ray place, those places you can cause, so you're not allowed. So that's why those are things you got to watch. Neglect or lack of mental stimulation early in life.
Yeah, that is the reactive attachment disorder.
Yes.
That people
Then the last one he talked about here is some people with learning disabilities have additional physical disabilities or sensory impairments. So going back to this issue about disability, yes, some of the causes, so people, when you are pregnant or when you are in a situation or some of these things, when it happens, you got to kind of not be so much spiritualized in it, yes? But you got to look at broader things. What has happened during my pregnancy, during my lifetime, or there's a genuine accident. When you are in a car and you are pregnant, or when you have a brain damage, a child has brain damage, definitely, if it's not diagnosed properly with subsequent treatment and support, there's going to be a learning disability issue.
Uncle, before I talked about the cerebral palsy, I just want to, the Down syndrome that we were talking about earlier, for instance, I've known 3 African men who's gone into hospital when their wife have had Down syndrome, who's walked out of the hospital and left the wife in the hospital saying that this child, we've never had that in our family. And I just want to tell people that Down syndrome is not an inherited thing. It is a matter of chance, something that went wrong when the division of the cells happen and an accident happens, and that is what happens. No one knows who is going to have a Down syndrome child, let's say. And therefore, when it happens, we are not to blame the woman and therefore walk out of the hospital and saying that maybe you did something, you cheated on me, that's why God is so. Because in this case, this woman, she had the Down syndrome baby, and the husband came, and my goodness, shouting and calling this woman names and whatever. He has to be walked off the ward, and he never came back for the woman, He never came back for the woman.
That's trouble. That spells a lot of trouble for the future of this mother and the baby. But Auntie, do you remember as well those days when you go to Ghana? I mean, I think it's happening because I actually found one story on the internet recently where children are taken into the bush in the
cerebral palsy one. That's what I'm going to talk about
really
them
deep
later.
into
the cerebral palsy,
and they killed.
Sometimes they say seaside.
It's seaside, and they drown them or kill them. They're doing it still, in
recently,
the deeper.
Recently there was a case on the radio about somewhere in eastern region of Ghana where yes, they announced where I think the grandparents, one of them, I overheard. I was driving and they were talking about where
I hope they were arrested.
Yeah, they were arrested. Yeah, because the child had difficulties and I understand one of the parents had assisted in killing the child or whatever.
I mean the problem is with the cerebral palsy. That is brain accident during birth, when the child is starved with oxygen, and so the brain death happens that time. And often the reason why back home people are so afraid of cerebral palsy is that you then have this child who makes certain movements,
noises and growling noises.
yeah. And the neck and moving limbs, and people assume that, oh well, this is
It's
like
a witch.
yeah, or a snake or something you've had. So people not understanding, but people with cerebral palsy, I mean, I don't know whether those who are doing that saw. I think during the Olympics there was this young lady who's got masters in, I've forgotten what she's got masters in, some science subject, who was one of the equestrian. I think, I don't know. She didn't do dressage, but she was one of the horse riders, and she has got serious. Even her speech is not clear. Cerebral palsy, but she has got masters and she's doing all right. And recently I saw this one girl who was buying a 2 million house in central London from her brain injury money that they gave to her. And she's cerebral palsy, and she was coming to university. That's why she wanted to buy the house. Yes, there are some people who can't do anything at all. In every syndrome,
so it's in categories. You have the mild, and the severe, and the
so
medium.
you can have, because I know a woman who has got 2 children who have got cerebral palsy, and these 2 children can't do anything at all for themselves. And like in Ghana, because they are dribbling of saliva also put people off, and they making people think that, oh, it must be an animal or something like that. And I think that is the but it is a brain injury, and if people will look at it, it's the same thing like when an adult has a stroke or had an accident and they hit their head. They will start, some people start dribbling. It doesn't make them an animal. It makes them it makes them different. It's the same person who had an accident, and I think that we've got to sort of understand that cerebral palsy is just an accident that's happened to someone during birth, and it's not because they are some creature that's come onto this planet. And I think sometimes all this movies and whatever don't also help out, because they portray
the worst scenario.
people with disability in the worst way
one
that
of
they
them
can.
That annoys me
and
very
sometimes
much
they
is the
call
one
them,
that they stammer a lot. They stutter. But why should you use somebody stuttering to be like, the way they play them? It's really, really
the way
sad.
they play, the way that sometimes
I get really annoyed. I wouldn't even watch.
It's so wrong. And then they will say, oh, the alien, and then you find out that alien that they're saying, that creature on the telly that says alien, has got features of someone with disability. And what makes them alien?
So you're associating the negativity
with them already.
It's interesting. The Department of Health put this learning disability in some categories, which kind of encompasses some of the things we've been talking about in terms of some areas. It says a learning disability is defined by the Department of Health as a significant reduced ability to understand new and complex information, to learn new skills, and into brackets it put, so the new skills into brackets into impaired intelligence. Then it says of a reduced ability to cope independently, into brackets impaired social functioning, which started before adulthood. So that's why it's important that once, whichever category, because it's a range, and it's been labeled or it's been diagnosed, not labeled, it's been diagnosed, then you have to find the consequence, because the beauty of people is that they might not be able to do one thing, but there are other things they can do. So you have to kind of look at the category and identify it and support them. And that's what,
like I was saying that, listen, some people with disability, especially when we are talking about Down syndrome, and if you go to Down syndrome, people with Down syndrome, and you go to their homes, there are some of them who can't do anything at all. There are some who you may see on the bus going with their handler, who will go and buy their things, they are okay, and they'll go and they help them to cook their own food, help them with other things. But there are some that, yes, you can help them, but you have to understand that every day the same information you have to give it again, and not for you to get frustrated with it. They can't keep it.
It's part of their
It's part of their disability, so they can't keep it. So don't keep saying that. Well, I told you this yesterday. Why can't you? I just told you that. They are not trying to be difficult or smart or whatever.
Just naturally they can't.
Naturally they can't. So you may find yourself that you are telling them that so and so go and put their book on the table, and you might have to point the table to them because sometimes they don't understand what the table is.
Absolutely, yeah.
Yeah. So you might have to point and say, "This is the table. Go and put it on that table," and they can go and put it on that table. But don't get upset when you want them to bring it back from the table if they still
don't understand.
They don't understand. And I think that is the issue that we have got. That sometimes we get so frustrated with people who've got disability, and we are only talking about even the intellectual ones, and especially if it's coupled with the physical and other things, it makes it even more challenging. But people genuinely don't understand what you are telling them. It's not that they are trying not to understand you. They don't understand. And this sense of, the person is trying to be very difficult, especially those who, like Uncle said, it's very, very vast. Sometimes people will understand someone who clearly has got a specific cerebral palsy looking person. Sometimes people will understand. But the ones who've got similar, but they don't look cerebral palsy, or not, they don't look Down syndrome, not cerebral. They don't look like a Down syndrome person, but they have got the same disability as that person with Down syndrome. Sometimes it's very difficult for people to work with them or people to try and support them because they think that, well, but if the person has got Down syndrome, I could understand. But not knowing that Down syndrome also comes with different categories. Some people can do a lot for themselves, some can't. And so it makes it very, very difficult. So as parents, if your child doesn't look Down syndrome, but you're seeing that they have got, it's very difficult for them to retain information. And everything you have to point it to them, you have to repeat it. Don't be so frustrated with them. Get help for them instead of being frustrated with them and thinking that how come you can't help yourself? Because that child, for instance, will not be able to button their own shirt. They will not be able to put on, sometimes they will not be able to put on even their own socks, let alone lace up their shoes. They may get to the age of 10 and not know left from right.
Absolutely, yeah.
Right? So we've got to be open-minded and see, this person is struggling, and give them the right support. And if we can't give them support, seek support for that child.
There's a lot of support so much. Unbelievable.
So far as there have been diagnoses, there will be. But there's also one thing we have to put in terms of this disability. It talks about sometimes the term global developmental delay.
Global
which
developmental
it says is
delay.
used to describe a learning disability, a condition that occurs between birth and age 18, which prevents a child from reaching key milestones of development, like learning, to communicate, processing information, remembering things, and organizing their thoughts. So this global developmental delay, as Ma'am was saying initially, when we are doing the initial ages of development, when you don't take your child for the
you don't get
the
that.
6 weeks, the
12 weeks, and then the
8 months.
18 months and 3
and then 2.5.
You'll be missing some of these things because sometimes you realize that as the child goes along, especially some premature babies, or it might not necessarily be premature, some of their delayed and their functioning are quite below their age groups and their peers. So it's about you as parents not missing this high of appointment, because sometimes we do assessment and realize that they say the book is not there because they have not done it, and they were giving us. So when you're able to do some checks with GPs and other professionals, realize that there are big gaps, and the children start school or they start play group and there's a significant delay.
Yeah.
So it's about making sure that we are aware as parents, carers, to be able to kind of support our children who may be going through the global developmental delay.
Yeah, I mean, like you were saying, that especially if you are talking about premature, often we correct their date. Let's say you're born on the 1st of January, but you were meant to have been born the 1st of March. For the first year, we expect you to be delayed.
Yeah.
But by the time you hit 1 year to 1.5, you should have catch up with the other children. Yeah. So if you haven't done that, and because you, the parent, can't keep on, because the necessities delay was because it was early, that is why. No, after the child is a year and over, they shouldn't be delayed any longer. They should have catch up, right? So there are things that we need to look for and ask more questions. If you are a parent and you've got the hint that something is wrong, probably you're right. So why not ask? I always say that
the worst they can say is no.
No.
Yeah.
And I always say that these days we don't send people to the Tower of London to behead them any longer. You won't be killed by anyone. So why?
So the worst they can say is no. Why don't you ask?
Yeah.
Why don't you ask?
So me,
Ask.
I'm not afraid of asking at all. It's always
the system
important.
is there for always to be used.
Yeah, and people are not
Push.
using the resources.
Yeah.
There are a lot of resources out there.
There are a lot. And if you have got a child with difficulty or disabled child, there are a lot of charities out there in community. You walk through the high streets, they are there. And they are full of information and support.
Yeah.
So even if you won't go to your doctor, go to one of these sessions. They will pinpoint you to all the places that you need to go.
Yeah.
And they will help you sort of navigate.
Yeah.
Because sometimes it's difficult for you to go maybe sit in front of your doctor when you don't know what to ask for. But all these charities, they are very, very good in helping you pinpointing what it is that you need for your child. And they will support you to go and get it. So the signposting with them is really, really good. So here in UK, you don't need to be afraid. You can just walk into all this, but they are so good. The charities, they are so good in supporting, so ask for help and get the right help for your child.
Yeah, so we are about to finish the program now. I think we've exhausted all the areas, haven't we?
One thing that I wanted to say, I wrote on my form, is that when we're talking about the fetal alcohol syndrome, also, what really also can cause disability in children, especially in neurological problems, is people who have got STDs like gonorrhea and syphilis. If it's not treated, you have a child.
But some people may have it, they don't know. They don't know, especially the syphilis, isn't it?
Yeah.
It's the syphilis that you have and you don't know about it. They've had it for years.
Yes,
and they don't know about it because when they were young, they were probably all over the place.
Yeah, but with STD, sometimes it's not that maybe the person is all over the place. Sometimes the person maybe went to one place once.
And the person is gone, yeah.
So it makes it very, very difficult. So that's why it's really, really important that when you're pregnant, you really need to have a proper checkup. Go to antenatal early. If they said you need to go to the hospital for a dating scan, go.
But with the pregnancy, are they doing smears now?
If you are pregnant, you might not go. But
so then, how would you find out if you?
We do the blood test and we check everything. You will know. You will know. You will know.
So anyway, thank you very much for joining us. Our topic today has been very interesting and educative. We talked about learning difficulties, parents with children, taking care of children with learning difficulties and learning disabilities. We hope you learned something from. We certainly have learned a lot from this, and we're happy you joined us. Next week, tell somebody that we're always here Sundays, 6 o'clock to 8 p.m. We will tell you our topic for next week later on, because we have to obviously discuss it first. We'll tell you about our topic later on. But thank you very much for joining us, and we're out for now until next week, same time, same place.
our producer.
Sorry.
Acknowledge our producer.
Yeah, we do acknowledge our producer.
producer.
Our producer as well. We've got our producer here.
Uncle Manasseh, who has been always great.
Our patient Uncle Manasseh here, who is always supporting us.
Yeah.
Because we are not technologically savvy, and he is the savvy one. Yeah. Supporting us. So thank you very much.
He's the man, the brain behind the
whole
whole
We just want
thing.
to give a shout out to all our young people who are not here with us today because they're writing their GCSEs and all sorts of and A levels. Yeah. We want to give a shout out and say good luck and God bless you. And we want to say finish hard, Stephen, Rhoda, Trish, Daniel, all of you.
All of you over there.
Yeah.
We say finish hard and get the
Michelle.
grades. Yeah. God bless you so much. We love you.
Hey, Francis, I haven't seen you for a long time.
All right. Take care. Yeah. And join us again next week. Thank you.